Hello, Professor Cummings and my fellow classmates. My name is Alex Phillips, and this is my presentation on thyroid storms. In this presentation, I aim to cover several things. This presentation will discuss what the thyroid is and what a thyroid storm is. Additionally, it will go over the possible symptoms and causes of thyroid storms. The presentation will also discuss Graves' disease and thyroiditis. The presentation will also examine the role of iodine in relation to thyroid hormone production. It will discuss how genes and age can influence the likelihood of thyroid problems too. Next, the presentation will go over 4 types of treatment. Then, it will give some medicinal treatments that are generally given to treat thyroid storms. Finally, the presentation will discuss how to prevent future thyroid storms and other thyroid problems. Put simply, the thyroid is a gland located in the front of the neck. It releases hormones that assist in sugar breakdown, helps regulate body temperature, control heart rate, and monitor the metabolism. The 2 components that make up the thyroid's hormones are thyroxine and triiodothyronine. Since the thyroid is such an important gland, the body can suffer greatly whenever there are complications with the thyroid itself or production of the thyroid hormone. Since a thyroid storm is a complication of hyperthyroidism, we need to discuss what hyperthyroidism entails. Simply, hyperthyroidism is when the thyroid produces too much of the thyroid hormone at once. This condition can be chronic and even life-threatening. A thyroid storm is when hyperthyroidism is at its peak and untreated, thus becoming a life-threatening medical emergency. In the next section, we will go into even more detail about the symptoms of a thyroid storm. There are several symptoms that can be present when afflicted with a thyroid storm. The most prominent symptoms are high fevers, agitation, loss of consciousness, delirium, and heart failure. As mentioned before, the thyroid assists in regulating internal body temperature. The symptom of a high fever is a consequence of a thyroid not functioning properly. The symptom of heart failure is understandable when remembering how the thyroid also plays a role in how fast the heart beats. Next, we will go over possible causes of a thyroid storm. There are several causes of a thyroid storm, but the most prevalent are Graves' disease and thyroiditis. There are also some risk factors that make people more susceptible to thyroid storms. Some risk factors are age, sex, and iodine intake. In the next 4 slides, we will go over these in more detail. Graves' disease, also known as Bastow's disease, is an autoimmune disease. This disease targets the thyroid gland and causes it to have a massive overproduction of the thyroid hormone. Puffiness around the eyes can be caused when the disease forces the immune system to target the muscles around the eye. The thyroid also swells because of inflammation. This can make it appear as though the afflicted person has a lump in their neck. As mentioned earlier, the thyroid plays a role in the heart rate. It is logical for Graves' disease to end up speeding up the heart rate of a person. In the next slide, we will talk about another possible cause of thyroid storms, thyroiditis. Thyroiditis, put simply, is the inflammation of the thyroid. This condition is generally caused by other diseases or conditions. The most common form of this condition is Hashimoto's thyroiditis. Some symptoms of thyroiditis are fatigue and swelling in the front or the side of the throat. As discussed on the last slide, it is common for lumps to form whenever the thyroid is inflamed and swollen. Each case of thyroiditis is different, and some cases can be chronic. In the next slide, we will discuss how iodine impacts the thyroid. Iodine plays a significant role in the production of the thyroid hormone. When iodine is consumed, it is absorbed into the bloodstream. Then the thyroid takes that iodine and oxidizes it. The oxidized iodine is then used to make triiodothyronine and thyroxine. Too much iodine however, can cause an overproduction of thyroid hormones. This leads to hyperthyroidism and other thyroid-related conditions. The opposite happens when there is too little iodine. Since there is not enough iodine to produce thyroid hormones, the gland is underperforming, and the patient can develop hypothyroidism. In the end, iodine is crucial to the thyroid gland and hormone production. The next slide will discuss possible genetic factors. Stereotypically, thyroid problems are more prevalent in women. This is primarily due to the prevalence of high stress events in their lives and constant hormone fluctuations. Additionally, women in their early 40s are more likely to suffer from thyroid storms. Another possible risk is family history. Both hypothyroidism and hyperthyroidism can be hereditary. In the next slide, we will briefly talk about treatment before breaking it down even further. Over the next two slides, we will talk about the four types of treatment and medicine frequently given to treat thyroid storms. But first, let's briefly talk about the intensive care unit, or ICU. Since thyroid storms are not only a medical emergency, but also life-threatening, an afflicted patient will almost certainly be placed in the ICU. Once the patient is out of imminent danger, they will be transferred to a general medicine unit. During the patient's time there, they will be given medications to treat their symptoms and address the problems with their thyroid. In the next slide, we will discuss the four types of treatment. There are four different types of treatment when it comes to treating thyroid storms. The first method is to target thyroid hormone production. This not only improves the patient's condition, but also decreases the chance of them having another thyroid complication in the future. The next category of treatment is to target the affected tissues and organs. In the case of the patient's thyroid storm being caused by Graves' disease, the doctor would treat not only the thyroid, but also the impacted tissues around the eye. If the thyroid storm is not caused by Graves' disease, then the method of treatment is to target the primary illness or condition that started the storm. This could simply be prescribing medication to deal with hyperthyroidism, since thyroid storms are essentially a more severe and life-threatening form of the condition. The last method is to treat the symptoms and side effects. In this case, it would be prescribing acetaminophen for the higher fever or medication to assist with controlling heart rate. That leads us to our next slide about medicine given for symptoms of a thyroid storm. There are multiple different medicinal treatments for a thyroid storm. The first treatment we will cover is thioamides. Thioamides are used to prevent the thyroid from producing more of the thyroid hormone. The next treatment is iodine solution. As mentioned earlier, iodine is crucial to thyroid function, so it makes sense for doctors to prescribe iodine solution. This treatment also works to stop the thyroid from releasing more hormones. Another option is beta blockers. This treatment helps lower blood pressure and control heart rate. The next type of medicine is respiratory treatments. This treatment is generally given in the form of supplemental oxygen and is used in more severe cases. The last treatment is acetaminophen. While a common form of treatment, it can be useful for taking care of fevers. In the next slide, we will discuss ways of preventing further thyroid complications. There are several ways to prevent future thyroid illnesses. For those who have already been prescribed thyroid medication, it is crucial to maintain the routine of properly taking that medication. It is especially important to take the proper medication before stressful surgery or going under anesthesia. Another way to prevent thyroid problems is to simply manage stress. One last tip for prevention is to meet with your medical provider if you feel as though you're observing any symptoms of a thyroid storm or any other thyroid-related illnesses. We have reached the end of the presentation. Throughout this presentation, we learned about what the thyroid is and what thyroid storms are. We also covered possible symptoms and causes of thyroid storms. This presentation also discussed what Graves' disease and thyroiditis is. It also covered the role of iodine in thyroid production and hereditary risks for thyroid storms. The presentation also went over the 4 different methods of treatment and common medicinal treatments for thyroid storms. Lastly, it covered ways to decrease the chances of developing a thyroid storm or another thyroid-related condition.